Hello, everybody. It is great to have all of you with us this afternoon for Medicine Grand Rounds. And it is my particular pleasure to get to welcome back to Mount Sinai Dr. Karen Leitner. Dr. Leitner is the founder of Karen Leitner MD Coaching, where she serves as a life coach for women physicians around well-being, burnout, and other career issues. She received her undergraduate degree from Brown, her medical degree from the University of Rochester, and was a resident in the combined internal medicine and pediatrics residency here at Sinai, where I had the pleasure to work with her for 3 years. After leaving Sinai, she held a number of primary care jobs in the Boston area and a faculty appointment at Harvard Medical School. I'm really delighted that she's here today to share, what she's learned both as a primary care physician and in her coaching role about both in the practice of medicine and about the practice of medicine. So we're really delighted to have you back, Karen.
Oh, it's such a joy to get to be here. I was trying to think about if I had any funny stories or anecdotes to tell about you from residency, because I don't think we ever worked.
Probably just as well that you don't, but.
Well, here's what I will say, because we had a continuity clinic together, and I feel like that's where we got to spend time together. And it was, 20 years ago. So a lot of those details are fuzzy. But what I do remember is how kind you always were to me and to everybody. But those, residency was not an easy time for me at all. I would say it was maybe one of the most challenging times in my life. And the people who are kind, you'd never forget that. So thank you for inviting me back. And I'm so happy to be here. I'm going to share my screen. I'm going to encourage, if anyone is here and they're not on camera, to come on camera. If you can, if not, it's totally fine. But I think sometimes we're very siloed and it can just be a nice way to connect when we can. So I'm sharing. Bear with me for 1 second. This is always a little bit tricky. All right. Okay. So I call this talk Sustainability in Healthcare, Healing the Healers. Really, this is a sneaky talk about burnout. And I know for a lot of us, that's a trigger word and people have thoughts and feelings about it. So this is what I called it. And Matt was kind enough to introduce me. I am a life coach and a physician. And I think that just brings a different lens to a topic that I care very deeply about. And so I'm really just so honored to be here to talk to you about it today. And I will say that this is, a personally important story for me because I did experience burnout. And like I said, I did go through a hard time during residency. And so I'm going to share my story a little bit and then talk to you about some information that I think maybe you don't know and it would be helpful for you to learn. So let's see. I want to disclose I am the founder of Karen Leitner MD Coaching, and I do coach women doctors. I'm also an advisor for a company called Enlightened that helps match experts in the field to companies that need medical expertise. And then I worked at Teladoc for a number of years and I left in September 21 and I'm not affiliated with them anymore. So this is me. This is my ID badge when I took my first job, and I did primary care med peds, and I was so happy and shiny to show up and start taking care of families in 2006. And then 7 years later, I left. I was burnt out. I had a lot of anxiety that I hadn't managed to have treated. I don't think I fully realized how much it affected me. One of my daughters was ill, although she's fine now, but she was going through some medical things. And the piece I want to point out is that I really felt like it was me. Like I was the reason why I hadn't been able to thrive in primary care. Other people could do it. I don't know what my problem was. I had had 2 kids during that time, and I had gone to halftime, even though I never shrunk my panel. Don't ever do that. If you ever cut back, make sure your panel decreases with you. But I left, and I don't think I asked for help within my organization. I'm not sure I really told anyone because I thought it was that I was the problem. And no one would have known. To the outside, that's what can be so sneaky about this. And the same with residency. I think for the most part, to the outside, I seemed like I was doing fine. People were very surprised to why are you leaving? It seems like you have this great life and everything is working perfectly for you. So, when your identity is so tied up in being a physician, it can be challenging to navigate. Especially I went into this sort of non-traditional, non-clinical world of virtual care and virtual transgender care. And I loved it, but I still struggled with some of the same feelings until I found that role, unfulfillment and guilt and inadequacy, and learning the tools of life coaching was really transformational for me. It just taught me a different way to think about my life. And I realized part of why I had struggled in residency and also in primary care was just because of how my brain tends to think. And I'll talk to you a little bit about that at the end, but there's a way you can harness the power of your mindset to really influence your experience of your life for the better. So this is a little bit of a roundabout story, but I promise I'll get back on track. During the pandemic of March of 2020, I wanted to help physicians. I was doing my virtual role and I wasn't being exposed. I wasn't on the front lines, and I felt awful about how many people were being exposed, and the lack of PPE and the lack of advocacy for physicians on the front line. So in my state, which is Massachusetts, we formed with 2 other women physicians, we formed a nonprofit, an advocacy group. And I was sort of like one of the media figureheads because I wasn't worried about backlash or punitive measures for my institution because I was sort of like a freelancing person. So this was really meaningful work to me, and then we got the governor to shut down the state, basically, and we did a whole bunch of things to raise awareness. And the group got rather big, and I felt like I wasn't having the same kind of impact I wanted to have. And I had invested in coaching to help myself with work-life issues. And I had signed up to become a coach because I really wanted to learn these tools. So I just decided to go on Facebook, where I'm an administrator for a group of Massachusetts women physicians, and offer free coaching because I wanted to help in a different way. And that's how my coaching business was really born. And so I was going to, a couple of years back, or maybe a year and a half ago, I gave another grand rounds, and I asked my Facebook group, I wanted to talk about wellness. And I knew that I was hearing a lot of, no one wanted to hear about wellness, basically. So I was like, well, what should I talk about? Like, how do I talk about wellness without talking about wellness? And I put that out there to my Facebook group. And this is what they said I should talk about in this grand rounds I gave. They said I should not talk about burnout, resiliency, ice cream socials, yoga, meditation, metric-based bonuses, self-care, wellness, or work-life balance. I was like, okay, what am I going to talk about? They wanted to hear me talk about how to manage the high patient acuity, staffing issues, fix the EMR, stop the backlash, get rid of all our paperwork, put Pelotons in the call rooms, get us some scribes, give me control over my schedule, and pay for me to be on call. So, this is all just to highlight that if we don't start with talking about the system and the way that the system contributes to why we struggle a lot as physicians to thrive and to provide care that we want to, it's like missing the boat. So this is a quote COVID, we're past COVID, but we're still really reeling from the impacts of COVID. So what I said was talking to healthcare workers about wellness during COVID is like talking to people in a famine about making healthier food choices. Like, it doesn't make sense, right? First, you have to be aware of the strength of the storm. We have to look at the systemic issues that are contributing to this widespread distress and suffering among physicians. And the definition of burnout that really resonates for me is it's primarily a system level problem driven by excess demands and inadequate resources and support. And this comes from Tate Shanafelt, who's a physician and very outspoken and doing a lot of research around physician wellness over at Stanford. So here's the learning objectives for this talk. I want to talk about what the most precious resources in medicine are. I want to define moral injury for you. I can't see all of you. I was going to ask, the ones I can see, are you already familiar with the terms moral injury? Yeah. Okay, so I won't spend a lot of time defining it, but I still think it's important to go over. I want to talk about the moral and the business case, the financial case for institutions to invest in physician wellness, and talk about how organizations can do that. And then towards the end, I'm going to talk about things that we physicians can do for ourselves right now to help us feel better. Because if we have to wait for the whole healthcare system to change, we're going to be waiting a long time. So here's the first thing. Physicians and healthcare workers, you are the most valuable resources in medicine. And I think in training, especially, sometimes we forget that because we're running around and we're so busy and we aren't paid a lot of money and we feel maybe insecure about some of our skills, but the system would collapse without you. And the system without doctors and, other healthcare workers, like there's no healthcare that can be provided. So even as much as, the fancy PET scanner or the robotic machine or whatever we're doing in the cath lab may be seen as like a valuable resource in medicine, you are the most valuable thing and you deserve to really be taken care of and to take care of yourselves. So just really quickly, moral injury is a term that started around the Vietnam era, referring to there was PTSD, which is sort of suffering people experience when they witness trauma and violence and harm, bodily harm. But moral injury is when you're forced to work in a way that goes against your own morals and values. And so for us, it's like all the things that exist between us and the patient, the EMR, the prior authorizations, the being limited in the amount of time we can spend with patients when you in the outpatient setting or wherever you are, this productivity sort of whip that's being beaten on us. And that all gets in the way of us just being able to care for patients in the way we want to. And it takes a toll over time. And so burnout is seen as like the end result of prolonged moral injury. And it has 3 like defining characteristics according to, anyway, someone who's an expert in burnout. I think it's the Maslach scale. I almost wanted to say the WHO, and there it is, Maslach and Jackson, 1981. So emotional exhaustion is pretty self-explanatory, loss of empathy, and then lack of personal efficacy, sort of feeling like, I don't even know that I'm making a difference. Like, why do I even bother? And I just remember a friend of mine who was an internist during, the height of the pandemic telling me that she had a patient who had declined to get the COVID vaccine, went on to get COVID, was intubated in the ICU and subsequently died. And she said to me, I don't feel bad. I feel bad that I don't feel worse about this happening. And is that normal? And I said, we don't have to judge it, but it's a symptom of burnout. And so if you don't recognize that that's what's happening, you're not just becoming cold and callous, it's actually a symptom of burnout. If you don't take steps to address that, it's not going to get better. So this is the 2023 US Physician Burnout and Depression Report. And if you look over on the left, it suggests, based on the survey that was answered by physicians, that 1% of physicians have attempted suicide and 9% have had thoughts about it, which is staggering. So we know something like 1 physician commits suicide every day, and the rate is higher among women physicians. This is a big, big problem. This is why there is a moral responsibility to do something about this. People are actually dying, and we need to take action. What's also interesting and concerning to me is when I gave this talk the first time, critical care, this was 1.5 years or 2 years ago, critical care was at the top of the burnout scale. And when I pulled it up this time, I was like, oh, things have gotten better. Critical care isn't at the top anymore. And I realized, no, like their numbers haven't stayed the same, but now emergency medicine, internal medicine, peds, all those outpatient specialties that have really like just managed so many things, everything in the healthcare system trickles down to these providers. These numbers have gone much higher. So we're moving in the wrong direction. So that's the moral and ethical case for us to address physician burnout so that we ease the suffering of our colleagues and some of us here. And Vivek Murthy, the Surgeon General, he said, this quote just really resonated for me. It's this desire to heal that brought us to do all this hard work. And for many of us was a really strong passion, like a reason for being, for me, at least, I really wanted to take care of patients. To see that loss is a really profoundly painful loss. So I guess before I get into the financial argument, I wanted to talk about just some things that are being done to combat this, but it's not enough, and we really need to do more. There's a collaborative that the Surgeon General has been outspoken about and is participating in to promote this to higher visibility, because I think, and I'm sure you can appreciate this, like the public does not seem to understand this crisis in healthcare that's happening. And they're having their own crisis, right? They're not able to get in to see their doctors, and their doctors are overwhelmed, and there's delays and all sorts of things when there's staffing shortages. Like patients are suffering also, but I don't think they realize specifically the emotional suffering and how much this has affected healthcare providers and what trouble we're going to be into if we don't do something about it. So this is one initiative that's been put forth. And I also wanted to talk briefly. I imagine since you're in New York, you're familiar with the Lorna Breen story. Dr. Lorna Breen was an emergency room physician who experienced COVID and had a significant depression and was hospitalized and eventually died by suicide. And what's interesting is her sister and her brother-in-law, when they started this foundation, it wasn't so much for her. It was because in the wake of her death, they received so much outpouring and messages and emails and outcry from other physicians saying that could have been me. I'm also struggling. I need help too. So this was made into a bill, and then it passed both the Senate and the House, and now it's an act, and it's $100 million over 5 years. That's also aiming to reduce and prevent suicide, burnout, mental behavioral health conditions among healthcare professionals. The sad thing is that there's lots of sad things, but in a lot of states, still, we're not following the guidelines that that the Federation of State Medical Boards issued about what kinds of things you can ask on licensure applications. Historically, and what Lorna Breen was afraid of was that if you had experienced any treatment for mental health, that might get in the way of you being able to receive a license. And so there's a movement to limit the questions that they're allowed to ask us. And to change the language in these applications so they're more supportive, to encourage people to take care of themselves. And it turns out New York, among other states, has the most physician-friendly questionnaire. It doesn't even ask any questions about your mental health. And so, a lot of people are mistaken about this. And unfortunately, she was also. So we're happy you're in New York, but there's a lot of work that needs to be done in other places. So now we're moving into the financial argument for physician wellness, because money talks, right? Everything is always built on the money. And fortunately, it aligns well, but I don't want you to think that this is as important or this is why we do it. The moral argument is, of course, the most important, but there's a strong financial argument as well. So to replace a physician in our current system, it costs upwards of $1 million, from start to finish, med school, training, all the support they need. So that's a huge cost when someone leaves medicine. Right? It's a huge loss. And it's estimated that over $4 billion is lost to physician turnover and productivity when physicians burn out, right? So you're a provider, you've been at an institution for a long time, you know the system, you know the EMR, you know the patients, you know where to refer. You burn out and you have to bring someone new in and train them and get them productive and get them used to everything, not to mention recruitment costs and all that. There's a lot of costs associated with physician turnover. It'd be much less expensive to just invest in improving physician wellness and preventing burnout and keeping people happy where they are. And there's an estimated cost of over $7,500 per physician per year is the cost of turnover attributed to burnout in an organization. Not to mention, patient safety is compromised when could be compromised, and there's costs to that, quality of care, medical errors, and patient satisfaction. So everyone wins when physicians are happier and their mental health needs are met. So I know this is a busy slide, but what this is a schematic of is similar to the way quality was introduced into institutions, 10, 20 years ago. It was recognized that when you measure quality and take steps to improve quality, you also cut your financial losses. And so this is just the steps or the different levels of proficiency in physician wellness that this author is proposing to bring wellness into institutions in a similar way that we brought quality, to normalize it. And so I hear anecdotally from some of my clients that yes, their hospital systems have wellness, people tagged to be the wellness proponents, but what that means is very variable. And sometimes it means hold an ice cream social and give everyone a Starbucks card, which is really inadequate, right? So the upper right-hand corner of this chart, that's what this little box is. It's what we aspire towards is physician well-being influences the key operational decisions at the hospital leadership. So there's a chief wellness officer that really sits in the C-suite. And when they're making decisions, in terms of the EMR, in terms of where they're investing money, they're taking physician wellness and physicians' ability to do their jobs into account. And then you'll see at the bottom is a culture of wellness. We have a long way to go, but this is the gold standard. So I hope that I've done my job in setting the stage that there's a lot of systemic reasons why physicians struggle and suffer and experience burnout. But like I said before, we are partly responsible also. And that's a good thing, because if it really had nothing to do with us, we would be powerless to help ourselves. And there is a lot that we can do to help ourselves not get burnt out and leave. And so that's what I'm going to be talking about next. And this slide is talking about the culture of medicine. And I hope it's different since I left my residency, but I know in talking to all my coaching clients that a lot of this is the same and it's very pervasive. So it's like the air we breathe. We are steeped in self-sacrifice, like it's a little bit of a badge of honor to be on call for a super long time, or to, how many cases you read, or how long the surgery was, or, even though I was like, I have a friend who is a surgeon, she talks about she had cholecystitis and she was wheeling herself around the hospital, still taking call, like waiting to go in for her surgery. And that was that's like the surgical mentality. I'm like, that is so messed up. Like, how is that okay? But I'm sure you have experienced this self-sacrifice and how it's sort of lauded. There's perfectionism. There's this invincibility. It's like, I'm going to have a baby and come back after 2 weeks, and that's okay, right? That's not okay. So things that we would recommend to our patients are very different than the way we show up ourselves. And in training, you don't want to be sick, right? You don't want someone else to cover for you. So you just show up sick and get sicker, and the patients get sick. And none of this is normal, but it's just sort of, we're like, well, that's just how it is, but that needs to change. And then learned helplessness refers to this idea that like, well, I can't change anything. And I think what I've noticed is there are certain things when you are a trainee that you really don't have control over: your schedule, the rotations you do, how much money you make. But when you leave training, a lot more becomes in your control, but we've sort of been indoctrinated in this idea that we don't have a lot of power and we can't really do very much. And I think that's part of why physicians don't unionize. And I just see this show up in people when they're when they're in a bad job situation and they just think, well, I had someone say, medicine's going to be the same everywhere. And I was like, no, it's not. That's very, like, why bother leaving? It's the same everywhere. It's like that attitude is going to really keep you stuck and prevent you from helping yourself find a better path. All right. Come on. So this is a quote from Dr. Robert Pearl, who's a former CEO of a really huge medical group. He wrote a book called Uncaring: How the Culture of Medicine Kills Doctors and Patients. And it says, the last thing you'd ever do is tell people you have to leave for an hour to see a therapist to talk about the emotions you were experiencing. And it's hard to imagine someone doing that, like, I need to leave rounds because I need to go see my therapist. Like, even if we do it, it's not safe to admit to that. And it's very much like it falls to the bottom of our priority list. And I think that this is another area that really we need to start destigmatizing and normalizing, because being a physician is traumatic. We experience trauma, we experience death, we experience patient losses, we experience lots of things that are outside of our control. And for many of us, we're not taught how to process and manage those emotions, which I think contributes to the high rates of anxiety, depression, substance abuse, and suicide among physicians. So that needs to change. So this is just a laundry list of all the ways that we have been indoctrinated into a culture that is not very healthy. Defer self-care. So I'm wondering how many of you are like up to date on your preventive physicals, and when was the last time you got like a golden weekend? Like a golden weekend seemed like amazing, right? It's like one golden weekend. We kind of need more time off than that. We kind of do need to sleep. We do need to stay home and take care of ourselves when we're sick. There's a blame and shame mentality. Some M&Ms are like, let's all point a finger at the person who made a mistake, instead of it's normal. We are all going to make mistakes. We are all going to have patients die. Probably it's going to be our fault. Sometimes that is just something we signed up for when we took this role. I sort of think we should change first do no harm to first do no harm intentionally, because there's no way around it. And so we're just hiding behind this lie that, good doctors don't have bad outcomes, which is part of the stigma around talking about malpractice, which is another problem. We're very self-critical. We hide our struggles. We rely on external validation. We delay gratification. We don't think things are going to change. And then we stigmatize help-seeking behavior. So I just wanted to take a minute to just say to you, like, your health and well-being really, really matters. Even if it doesn't matter to the institution or the program director or your boss, or, when you get out into the world, it has to matter to you. Like, I would just start there. And it really matters for society because we can't function without you. And I just wanted to make sure everyone had, take a screenshot of this in case you have a colleague or a peer who's struggling. A lot of times it goes unrecognized and people think, like, I had no idea. If I had only known that this person was having such a hard time. And the only way you know is if you ask. So ask if your colleagues are safe. If you notice someone is acting strange, just like ask how they're doing. And this physician support line is free and confidential, and it's an 800 number, and you can speak to a psychiatrist. And now what I'm asking for is for you to open your minds, like commit to the mindset that there is something you can do about it right now for yourself. And I'm going to take a slight detour into like the world of coaching to show you what I mean about mindset, because mindset's like a very vague and amorphous thing to talk about. But in the coaching world, it's like, it's everything. So I'm going to teach you briefly a little thought model that we use and just sort of see if you can start to like grasp what I even mean when I'm talking about mindset, really looking at like what you're thinking. So what you're thinking is what creates how you feel inside. It's not like being on call doesn't make you feel dread. It's what you're thinking about call that makes you feel dread, if that makes sense. It's what you're thinking about the patient who died. It's what you're thinking about the specialty you chose that makes you feel ambivalent or enthralled or doubtful. It's the thoughts that matter so much. And our human brains are constantly thinking thoughts all day long. And some of them are true, and some of them are completely untrue. And then some of them are really not useful to us. So it's just sort of starting to pay attention to how you're thinking and seeing how it affects your experience of your life. So that's this little exercise I just wanted to show you, is if you are thinking about your mental health as just something that exists out there in the world, and then the thought you believe about it is like, there's nothing I can do, which is a lie, because there's always something you can do, right? Even if it's just like, I'm going to stick my face in the window for 60 seconds and like try to boost my vitamin D. There's always something you can do. But when your brain believes there's nothing you can do, you feel hopeless. You're just like, yeah, there's nothing I can do. And then it's basically like your brain is Googling all the ways there's nothing you can do to help yourself. And you just find all that evidence and you confirm that theory, but only because you're thinking it. Right? So our brain kind of is like a computer that Googles our thoughts. So when I think there's nothing I can do, my brain is like, okay, I'm going to prove that true. I'm going to find evidence, all the ways there's nothing I can do. I'm going to wallow in it. Like, poor me, there's nothing I can do. I'm going to blame others. Like, this is all the system's fault. There's nothing I can do. I'm going to shut down. I'm probably going to avoid. And then buffering is what we do when we feel a negative feeling and we're trying to make it go away. So we might eat like 7 Twinkies, or we might go on TikTok for like way longer than we meant to, or we might have several glasses of wine. Buffering is just something humans do. Like, if you've ever been like, and I really need to go to sleep now, and suddenly like an hour later, you've been on Facebook and you're like, what just happened? Probably you were having some negative feelings that you weren't necessarily aware of, and you were like trying to get away from them. And that's what led you to do that thing. Not useful. Doesn't help your mental health, actually. We know that like social media doesn't help your mental health, and alcohol does not help your mental health. And so the result that we created with this thought that there was nothing we could do was that we didn't do anything, and we feel even worse. So that's one example of how this one little thought, we can change that. And we have to find a believable thought to stick in its place. And it has to be believable. I can't just believe like there's tons of things I can do. If that's not something my brain believes, then I just have to keep going until I find a better thought. So this model, we're still talking about our mental health, but now I'm thinking I deserve to take care of myself. And like, you just get to notice, how do I feel when I think that I deserve to take care of myself? For me, I feel determined. I'm like, yeah, I deserve it. Why not me? Like, come on. So then what I'm going to do from that emotion, I'm going to set a goal, adopt solution-oriented mindset, get out of my all or nothing thinking, come up with a whole bunch of ways I can help myself, and I'm going to move towards feeling better. And as much as this might seem kind of like woo, or just like whatever, this is actually, and Matt, I'm saying this towards you, like, this is how you get your charts done. It's like we find the feeling that gets us to write our charts, and we realize what we're thinking during the day that leaves us like not finishing them, rushing off to the next patient, over perfecting our notes because we think we're writing like a New England Journal article every time. We're just writing like, well, all the people we're worried are going to judge us when we're writing our notes. Like, none of those thoughts are helpful towards getting our notes done. And so you can pre-program your mind with the thoughts that help you get your notes done, and then you actually get your notes done. So you have to bring me back to give that talk. This is just some other things that there's data, there's evidence to show that they can be helpful. So mindfulness-based interventions, there's some apps, Headspace, to do like meditation. There's something called Unwinding Anxiety that's $7 a week. And they've measured these, and they actually have been shown to increase or to decrease burnout. Think Up is another one. Coaching, and obviously I am biased, so take this with a grain of salt, but it is an evidence-based intervention for physician well-being. And this study was out of JAMA, and for 3.5 hours of coaching over 6 months, they measured a significant reduction in emotional exhaustion, burnout, and an improvement in resiliency and quality of life. And what's interesting is that the subjects of the study who didn't receive the intervention, the control group, all their numbers, like their emotional exhaustion increased, their burnout increased. Instead of just imagining like, well, it'll just stay the same if I don't get coaching. No, theirs like went up compared to the experimental group. Peer support. I know that you are medicine people, but if any of you are planning on somehow, if you're transitional or you're going into a surgical specialty or you're doing procedures, this is, I can share my slides also with the group at the end, but this YouTube video is a doctor at Mass General talking about a peer support group, peer support program they have in place where when, if someone is a surgeon doing an operation, they have a bad outcome, something goes wrong, they immediately sort of wrap around, pull that person out and help support them, because second victim syndrome, is when the caregiver is harmed by the harm that comes to the patient. So not only did the patient get septic and die, but now the second victim is the surgeon who was trying to help them and now feels responsible, feels guilty, is ruminating, is blaming themselves. Like, that is a kind of trauma that there should be supports for. And in some places, not only are there not supports, but there's, they get up there in front of M&M and they get sort of pulled to pieces about how it is their fault, which is not how you learn, right? We always learn by studying our failures and figuring out what we're going to do better the next time. So places that have peer support programs, I think this is the wave of the future. And if I was a surgeon, which I would never be, I would want to look for a program like this where I was going to work. So what can I do? What can you do? First of all, you can just commit to being nicer to yourself. And this is a really tricky one because most of us have this like little internal drill sergeant that's like, you didn't do that right, you're going to get that wrong, and you look dumb thinking that. And I remember I used to write my notes. I would be writing my note and I'd be thinking about how the chief resident's notes were always so much better than my notes as I'm trying to write a note. Like, it's not useful to be thinking about that. And I'd be like, oh, I really don't know how to palpate the liver. Like, instead of, how about, you were just kind and helpful and doing your best and like haven't slept in 36 hours and you really want to learn and you spend extra time with that family. We always focus on, we call it the gap. There's a really good book for when you have time to read someday in the future called The Gap and the Gain. It just helps you notice. Our brains are wired to always look at all the places we're falling short instead of noticing all the places that we really are making a difference. So just noticing how you talk to yourself during the day and setting some limits. Like, it is not acceptable for you to walk by yourself in the mirror and be like, you look like crap today. That's just not nice. You don't have to do that, right? But first you have to notice that you are doing it. Notice what you can control. There's, if anyone has ever heard of this idea of the circle of influence, it's like we can put all our time and energy into hating the fact that, I don't know, we're in a managed care system right now. But we can't really do much about that on a global scale. Or let me take it away from medicine. Like, my daughter was spending all this time being so upset about global warming and climate change, but like not actually doing anything about it. And so instead of catastrophizing the end of civilization, which is out of her control, we're like, what can you do right now? What is in your control? Because when you focus on what you can control, your circle of influence over your surroundings gets bigger. And you feel better, you feel like you're having a better impact. And I can't even tell you how many clients come and there's this, like, we just complain, we vent to each other, we talk about how terrible everything is. And it makes us feel so much worse. We feel better when we feel like I can make a difference. There's something I can do. And I'm going to go do it. Spend 1 minute outside, just 1 minute. Some of us are very all or nothing. We're like, well, I can't exercise because I can't run a marathon. I don't have time to train. How about you just like go jog up a flight of stairs? Like 1 minute doing something for yourself. Can you find 1 minute? Use the bathroom when you have to. This is like a really big one. I know you're not, and you really ought to. So you got to practice. You got to tell yourself, I have time to do this, and it's important for me to take care of my body. Eat green things, not just those little graham crackers with peanut butter and like pudding that you steal from the L&D floor that I used to do. Get a coach. I really believe every physician should have a coach. You can do a mindfulness app. You can take a few minutes on your way home just to like settle your mind, just before you rush into your house and start doing laundry or taking care of little people, whatever it is that you're doing, just give yourself a little break. You can talk to your legislators about the importance of physician well-being. Maybe you do this later when you've caught up on some sleep. Check in with your colleagues, look to build connection, because connection heals trauma. That was something that was, sort of intuitive to me, but also really profound when I was listening to a trauma expert talk about how much trauma collectively we've experienced over the last few years with COVID, with the pandemic, with isolation, with just war and violence and natural disasters. And connection heals trauma. So even if there's just 1 or 2 people that you can confide with, or you can call when you're not feeling well, or you say hi to in the hall, being kind to someone else actually helps you feel better. And then realize you're not alone. And that is my talk. So I'm going to unshare my screen. Oh no, how do I do that? Wait a second. Okay.
Perfect. Thank you so much, Dr. Leitner. This was
Yeah,
great. I'm sure there are plenty of questions on the floor. I didn't see any in the chat yet. Maybe I'll start out by asking, kudos to Sinai, who does have a chief wellness officer in the dean's office and, has put a lot of effort. It's not perfect, but has put a lot of effort into some of these things. Are there places either in the US or are there other countries or healthcare systems where you feel like they get this better than other places and, we should be trying to emulate? Or is this, to your point about like, I can't believe it's going to be the same everywhere? Like, is it the same everywhere? Or are there real places that we can look to for models?
Well, it's not the same everywhere. I do think there's a big gradation. I'm not an expert in how they do this everywhere, but like for sure, Stanford has a whole program on physician wellness, and not to mention just for people who work there, but in the research that they're doing. But I think certain healthcare systems are way more toxic than others. Certain like private practice groups are way more toxic than others. And I think the most important thing is to sort of have your own sense of value and then go out in the world to find a place that recognizes you. Because I know I'm changing I'm like, I don't know the answer to that. Let me change what I'm going to tell you. But I see people staying. I see people believing that they don't have any power to change, when for sure there are places where people work where they are taken care of and where they are, some people ask for coaching and they're like, for money for coaching from their institution, and their institution is like, yes, that's a great idea. We want everyone to get coaching. Like, and then some places are like, we're not going to pay for you to, like, that's just too woo. Like, no, we're not going to do that. So I think there is a big gamut, but I don't know about a standardized way to assess. I think there's not a lot of places doing really well on this. Yeah.
Got it. Thanks. Other questions out there?
Hi. Thank you for that amazing talk. I'm Angie. I'm also one of the chief residents along with Manira. And I guess I had 2 questions, but maybe just the first question would be for, a program like ours, as in a residency program where our residency lasts 3 years, maybe 1 year for some of our prelims in medicine. What is the best way to advocate for and implement these larger institutional changes to have that lasting effect when we have so much, turnover of who's here and who is able to even benefit from things that we implement? Because I noticed this year that's something that we, as the chiefs, the medicine council, which are the representatives for the House staff, and our program director have talked about a lot is, we have these amazing suggestions for ideas, but they take a lot of time to implement. And I guess that may just be part of the reality of what's going on, but I don't know if you had any thoughts around that.
Well, I think what I hear a little bit of is like the idea of the marathon, right? You're like, we just don't have time for everyone in this program to run a marathon. I'm like, but we don't have to run a marathon. What's one thing we could do? Like, what's one thing you could do? Can you come up with one thing that you would be excited to do that you think might help move the needle towards promoting wellness? Do you have any personal like things that you would love to try? I think, the most important thing is like believing that it's even possible. And I know that might sound kind of hokey, but if you believe it's possible, then you just start trying things. And if you believe it's going to take a huge amount of time, then it's going to take a huge amount of time. But what if you just, I don't know, had like an anonymous chat email that went to the chief residents where people who are struggling could write to you and just be like, where can I go? What can I do? How can I get help? Like, I don't even remember feeling like I had that in residency, right? Just like one person that I could reach out to that maybe would help me and not judge me, and they wouldn't even have to know who I was. Like, that would be huge. So I think just starting small, starting with what you can do, I would just have some belief that it's possible for you. And I would just believe like, it doesn't have to take a lot of time. What's something easy we could do? And then you just keep going. If you don't like, we love to talk about in coaching that the only way you fail is if you stop trying. So maybe you fail and then you fail again and then you keep trying and see who else can help. That was also a very non-specific answer, but that's what I would think. Part of how I even got into learning about these ideas was just from a podcast. You can just listen to a podcast a few times and then you can change something in your life because you just see something differently. So it doesn't have to be, like the best, the most thorough program for wellness. It's like, let's just all do anything.
Thank you.
What was your second question?
Oh, I know Dr. Grabschied and Katya have some questions, but my second question, I guess, was tying back to about the question Dr. Weissman asked is like, as people who may be moving on to fellowship programs or on to jobs, whatever it may be, are there some, ways that we can tease out which places are supportive of, whether institutionally wellness initiatives and things like that? Is that something specific that, we should be asking in interviews?
Like advisor for wellness or something like Yelp for wellness. I think it would be important to just ask about like, what wellness initiatives do you have? And what is your maternity leave policy? And what kind of childcare do people get? And how do you help each other? I think it's getting a sense of, are people happy? The same way when you went to interview for different residency programs, there wasn't really like a resource that showed you if it was, you just had to talk to people and just see what their experience was. And I think sometimes you do all the right things and you still land somewhere that doesn't feel like a good fit for you. And I think it's important to realize you can leave. I don't mean to oversell that, but I just see people staying or even, being so like happy to just have a job. They're just like, don't realize that you're the asset, that you're the diamond. You don't need to take a crummy job just because you're so afraid that no one will hire you. You get to be like, I have this value in the world. I'm going to go find what really aligns, what really like feels good to me. But I think other things like, the benefits and PTO, and they allow for part-time work, and how the longevity of people, what's your turnover rate? You can for sure ask that, and that can be a good sign. And you can try to talk to people who have left is another way to get honest ideas. Are you going on to fellowship, or are you done this year?
I personally,
not to put you on the spot, if you know.
No. I personally have accepted a position. So I am going to be doing primary care at an academic institution. So, but I think definitely during the job search, I think it's a little bit tricky because some places offer that information upfront and say these are the things we would offer new faculty and things like that. In some places, I felt like I really had to go in and ask and be like, well, how long do people stay? And, have people gone on maternity leave recently? Again, can I talk to them and things like that? So,
yeah.
I don't know. I just thought it was an interesting experience going through that process and kind of having to figure out if, how supportive, certain places would be. So.
Yeah. And you know what, if you wrote up a little guide from your experience of like the questions you asked that were the most helpful, and then you just email it out or like put it in a file somewhere for people to come after you, like that's something you've done at your institution to promote like wellness and be helpful. I will also just say that I did this little series recently. I called it Life Support for New Attendings. And it's just like a couple of video replays that if you want to email me after this, or I can send them in a follow-up, but because negotiation is something I really care a lot about helping women physicians do. And so I talk about that in my talk, but also just how to set yourself up to start off in an attending role on a good foot. I don't know how you say it, but because I think for so many of us, we're like, finally, I'm an attending, my life is going to get so amazing. And it does in some ways, but then there's a whole new set of challenges that we aren't always prepared to take on. And I have a lot of thoughts and suggestions for how to make that easier for you.
Thank you so much.
Yeah, of course. Am I calling on the hand raises? Grab sheet.
Oh, hey,
Hi.
How are you doing? You show up on my Instagram every day, so I'm thrilled to actually have.
Oh my gosh, that's so exciting.
So Beth Israel
Instagram ads work.
That's right.
Beth Israel is actually known, we're kind of known in the community to be a super nice place to work. And it's true, we're very friendly and it's not a toxic environment at all. I think that just the nature of being a doctor, there's an incredible amount of work that has to be done every day, whether it's Beth Israel or anywhere across the country. So what's your advice? Because you work a very long day. At the end of the day, it's very hard to find time to go to the gym or eat healthy, do laundry, and then before you know it, you're back at work. So how do you carve out the time to kind of do the things that you're saying are in your control? It's just a matter of like a time. The math doesn't work for me so much.
Mm-hmm. Yeah, I think this whole time construct is very tricky, like sticky for physicians, because absolutely and undeniably, there are limits to how much time you have and how much free time you have. And also, we tend to, as a group of humans, waste time or like not use time the most efficiently. So as just an example, I had a woman come to my program who had couldn't get her charts done, taking her charting around home with her all the time, weekends, everything. So we solved that. And now we had 6 extra hours a week that she wasn't doing charts anymore. And then when I asked her, when are you going to work out? She's like, well, I don't have time. What do you mean you don't have time? I just found you 6 extra hours a week. Where does it go? So it's almost like I don't know if you've ever seen that analogy where you take a cup and you pour some sand into it, and then you try to fit the ice cubes in, and they don't fit and they spill over. But if you put the ice cubes in first and then you pour the sand, everything fits. It's like you have to carve the time, you have to determine the time, and then you have to just make yourself do it and realize that the other things fill around. So I don't know if that resonates at all for you. And I know it sounds a little hokey pokey, but for most of us, right, we are avoiding things. We are procrastinating. We are spending too much time in our busy work at work and not operating to our highest efficiency. because our minds are unmanaged, because we are driven by anxiety or by scarcity, right? Like when our thought is like, I'm not enough, or we have imposter phenomenon and we're thinking like, I don't know enough. That's what makes our notes too long. That's what makes us second guess our decisions all day and spend too long. Or then we wind up like doing Candy Crush because we're just like, oh, I can't deal with how I feel. So all these things, like I would start with deciding, like remembering your compelling why. Why do you even want to work out? Why do you even want to eat something healthy? And once you have really convinced yourself that it's really important to yourself, then with that energy, you solve for where's the best time for me to do this? Do I want to get up a little earlier? Do I want to go in the middle of the day? Do I want to do it on my weekend? Do it, when you ask yourself, where can I do it? There's usually, unless you're like, there's usually a time to do it. And it's usually more about the motivation or the energy or the wherewithal. And for me, at least, I'll like sometimes say to myself, okay, I'm going to wake up early tomorrow and I'm going to go running. And then my alarm goes off and I don't do it because I'm giving into, I'm like, well, I don't feel like it, so I'm not going to go. It's like building the muscle of like, you don't feel like it and you're going to do it anyway, because you just have built that relationship with yourself where you decide to do something and then you do it. So I don't know if any of those landed for you, or if you're just, or if I'm just like, you need to take a day off and go part-time. But sometimes it's like starting with the belief, oh, I can do it. Okay, future me is out there somewhere with my same job, my same schedule. She's going to the gym once a week. How is she doing it? And then like work backwards. And yeah.
Thank you. That was great.
Okay.
I know we have a bunch of other questions in the chat. Some other time you'll tell me how you save 6 hours a week in charting, because as you know, it weighs heavily on my.
Can you manage the chat for me? Because I'm kind of not.
Yeah, Manira,
Okay.
can you do that?
Sure, yes. So we have a question from Dr. Katya Murashka, and she's asking, what is the range of issues that are addressed during your coaching sessions, Dr. Leitner?
So the issues that people bring are, I'm exhausted. I don't have time to take care of myself. I can't get my work done. I'm up ruminating about my patients all the time. I feel like a bad mom. I feel like a bad daughter. I feel like a bad wife. I don't have a partner and I don't even know how to have time to go date because I'm working all the time. And so that's what they come to me with. But the issues that I actually wind up spending the most time coaching around are the mindsets of perfectionism, self-critical thinking, scarcity thinking. Like so many of us feel like we're just not enough. I mean, I would say that that was at the heart of so much of my anxiety and burnout, was like believing I wasn't enough. And no matter what I did, it didn't really change, but it was just because I was thinking it, not because it was true objectively to the world. And then charting, for sure, charting inbox, like creating boundaries, having balance, feeling more confident about your knowledge, about your clinical decisions, about the care you provide. But I feel like the heart of like, for me, what I think I do is I believe in people and I help them see how unbelievably valuable they are and how much they matter and the work they do matters and who they are as a person matters. Like, I feel like we spend time doing that because so many of us, we just lost that or never had that. And we're just super mean to ourselves all the time. And that's what drives a lot of these other things that show up for us. I hope that answered your question.
Thank you, Dr. Leitner. Yes, I think Katya said, thank you for addressing. I did get another question that I wanted to share with you, Dr. Leitner. So when you were deciding to leave MedPeds, how did you make that decision to leave primary care, asking for an actual resident who might be considering leaving medicine? How were you able to make that, of course, difficult decision? And what resources did you use to help you make that decision to leave?
That is a great question. When I left, I don't think I knew that I was leaving like forever. I just felt like I couldn't keep going. It was made out of like desperation. I was like, I can't do this anymore. I need to figure out something else. This isn't working for my family and I'm out of here. I wish I could say I was like, I just feel like moved and compelled to go into virtual care. It wasn't like that. And so I decided to leave. I sort of made a transition for myself. And then I talked to as many people as I could who I respected and I cared about to hear about what they did. And so for anyone who's considering leaving, what I would say to you is there's such a huge world beyond clinical medicine and for sure beyond academia out there. I would 100% finish your training if you've already been through a bunch of it, because that degree is so valuable. But there's so many things that you can do with a medical degree that you don't even have any idea how big of an asset it is. And I'm not even talking about biotech or pharma or, doing telehealth or another industry role. Like there's just, I think there's endless possibility for you, but I didn't know that at the time. So I talked to people and I would be like, I don't know what to do. And they're like, well, I know someone who did this. She did this urgent care thing. So I went to talk to them. Or I know this person who was at this homeless shelter. And so I went to volunteer there. I taught this class on social medicine. I went and did that. I just went to do all the things. And I will say I had the luxury of not being the primary breadwinner, so I could work part-time, and my husband supported me through that. And the other thing that's different now than when I did it, is that LinkedIn is a wonderful resource to just see what else is out there. Like there's so many startups and so many interesting things going on, people doing interesting things. That I did this recently for someone else on Facebook who was asking this kind of advice. I was like, you just go into LinkedIn and just put in like nephrology startup in the search button for content. And then you just find there's like all these nephrology like companies that you wouldn't have even known about. So my advice is start networking, start talking to people. Don't be afraid to get rejected. Like I probably would send a message to, 3 people. I said, my mission this week is to send out 3 messages to people who are doing work that seems really interesting to me and invite them to a coffee Zoom call and see if they say yes. And if 1 out of 3 said yes, like that was great. And then they would have someone else for me to talk to, and they would have someone else for me to talk to. That's how I wound up talking to like the chief medical officer of Walgreens. And then that's how I got connected to my, advisory position. It's just like when you are enthusiastic and you have a desire to serve and you are interested in medicine, you just make these connections and you find out that there's so many other things that you can do out there. And then you just get ready to try things and have them not work out. I worked for in this pharmaceutical role that I really didn't like. And then we got audited by the FDA. I mean, it was like a disaster, but now I can look back and be like, well, that's how I learned. I don't want to go in pharma. What else can I do? What else is out there? Just this abundance mindset of there's something that's going to be fulfilling to me and I'm going to go find it. And it's okay that I don't know the how. You don't have to know the how, because I never would have imagined in 100 years that I would have done all these different things. And I really thought I wanted to do like chronic disease, virtual management of chronic diseases. I was so passionate about that. And now here I am as a life coach for women doctors. I never could have known, but it's perfect. It's like exactly what I was meant to do, but you have to go through the journey.
Thank you so much, Dr. Leitner. I think Dr. Raghavan, our wonderful program director, comments on creating time. I work out while listening to Grand Rounds weekly once recruitment season is over. That's great to know, Dr. Raghavan. Thank you.
Yeah, I really think with the time stuff, I can stay over a little bit. I don't know if you all have places to go, but like sometimes we're committing to things and we're saying yes to things that we don't even want to do. And that's where some of your time is, or you're doing unpaid work, you're on a committee or you're volunteering somewhere and you don't even want to be doing it, but you're doing it out of obligation or you're saying yes to people. So being able to, if you want to do that, of course, do it. But you start to listen to, if there's things you don't want to be doing, say no. And deal with feeling a little bad because so many of us are people pleasers, but that's how you've taken like your life back. It's like you just tell yourself, I'm leaving at 6 p.m. And if there's 3 messages in my inbox, I'm going to do it tomorrow. And it's like, am I allowed to do that? Yes, you are. That's how you create time for yourself. Because most of us, we just keep doing the work. And the truth is your inbox will never go to 0 because patients are always getting sick in the world. Inbox 0 isn't a thing. You get your inbox to 0 and you turn off your computer and there's already a thing in it, right? And you don't even know. So that's not the goal. The goal is like you decide, I'm setting this boundary for myself to take care of myself. And I'm just going to sit with how uncomfortable that feels because on the other side of it is me taking care of myself and having a life that feels better. I don't even know if you guys have inboxes, but you will one day.
All right, it is 1 o'clock. I need to go see patients. I think there are a bunch of other people who need to go see patients. It sounds like you're open to people reaching out to you in various ways.
Yeah, of course. I was going to see if I could just put my email up here again. I'd love to hear from any of you. And I really would be happy to come back. Oh, I am coming back. Aren't I going to come talk about negotiation at some point to the women Did we talk about that? All right, I'll email you.
Yes, we have more women in medicine representatives here who are waiting to
Perfect.
talk to you, Dr. Leitner.
Perfect. All right, thank you
Thank you so
much.
much for was
I
really an
enjoyed it.
amazing talk, exceeded my already high expectations of you. So, so thank you for joining us.
Have a great day. Thank you
everybody, for joining
all.
us.
Good luck.